So Practice Ready Ontario is a Ministry of Health funded pilot program that looks at an alternate route to allow internationally trained physicians to be licensed to practice as family physicians in Ontario. It follows pan-Canadian standards in terms of an assessment process that determines whether these internationally trained family physicians have what it takes and are competent to be able to practice safely here.
So what's the process like now for internationally trained doctors when they move to Canada?
Yeah, so at the moment, the main pathway for internationally trained physicians to enter licensure and practice in Ontario as a family doctor would be through residency training. Typically, at this point in time, it's about 2 years in duration from the beginning of the training to the end of the training. So it takes approximately 2 years to train a family physician. For Practice Ready Ontario, we're looking at approximately a year in time from the beginning of our assessment process until the end when a successful candidate can be licensed to practice.
So you're essentially hoping to cut the time in half?
Right, and you know, we're working on efficiency as well at this point and hoping maybe that in the future we may be able to make that a bit better.
So do we have a sense at this point of how many doctors are living amongst us who would like to be practicing but can't?
We don't have accurate data on that. However, in our experience with the residency match in Canada, in Ontario in particular, we have about 1,200 applicants every year for about 121 positions. So that gives you a sense of how many internationally trained physicians who may be out there who have practiced elsewhere.
Okay. So how would you be able to cut that time in half? Why would this program be able to get these doctors ready sooner?
Yeah, so what the program focuses on is selecting highly trained and qualified internationally trained physicians who have been trained and working as general practitioners or family physicians in their home countries. And because of that, you know, we're really selecting the cream of the crop, if you will, and folks who are most likely to be competent to practice. And then we have them go through a 12-week rigorous assessment process where they're working under the direct supervision of another experienced and licensed family physician here in Ontario to determine that they're competent enough.
What kind of things will you be assessing?
Yeah, so you know, if we look at what family physicians do, especially in the underserved and rural areas, they work in the hospital, they work in the emergency room, they work in the usual clinic fashion. And we do assess these internationally trained physicians in all three areas.
Okay, so when a doctor moves here, there must be other challenges. Is there anything beyond licensing that doctors who aren't able to work here need help with?
Oh, absolutely. You know, I've been in the education world for about 20 years, and I have trained and worked with internationally trained physicians for 20 years. A lot of them are my friends, and I know their journeys. It's extremely tough. Just imagine if you had to move yourself to a different country, along with your family, you have to make a living, you have to provide for your family and yourself. At the same time, you have to take a variety of different examinations to further understand the local healthcare system and so that you can be prepared for either residency training at this point or Practice Ready Ontario. So I have a lot of respect for my colleagues, you know, who are in these situations, and they work very hard to try to get licensed.
What kind of work are doctors doing in the meantime as they wait, as they have to support their families and they aren't able to practice medicine?
Yeah, I know many of them, you know, do look for work in the healthcare field, sometimes in research, sometimes in administration. A lot of them, at the same time, you know, they volunteer with other family physicians to try to better understand the healthcare system.
So how much of, or how many people do you think at this point, do you have a sense of how many people you might be able to help here?
So our goal by end of 2025 is to be able to process 100 candidates through our program. So if all of them were to be successful, then we may have 100 new family physicians in Ontario.
And what would that mean? Like, what kind of dent would that put into our healthcare crisis?
Yeah, so if we look at currently the average roster size or the number of patients a single family physician may provide care for, we can say, you know, safely maybe about 1,000. So if we had 100 new family physicians, we're looking at 100,000 patients having a family doctor.
Okay.
That's significant.
Very, yeah. Like, how big do you think this program could get if it's successful in these early days?
I don't have a good sense of that at the moment. We're still in our pilot phase. So as we finish the pilot phase, I think we would have a better sense in terms of how we can scale the program.
Why is this something you're so interested in being involved in?
Yeah, so as I mentioned earlier, I've been in the medical education world for the past 20 years. I work at the Western University in the Department of Family Medicine. And my main job over the last 20 years have been to train family physicians. Really, I think it's a goal of mine to be able to help Ontarians to get the health care that they need and deserve.
Dr. Wong, thanks for the work you're doing. Thanks for telling us about it this morning, and thanks for being here.
My pleasure, Andrew.